No, I don't get to do that on mine. I don't know why. It must be my.
It's kind of funny. Hey, Stephanie, thank you. It's kind of funny seeing everybody like they're in a movie theater. I don't know if anybody else was able to put that view up, but it is kind of funny.
It
This is
looks
the
weird.
first time that I was able to get in and have this view, and it's actually pretty funny.
And just so everybody knows, this is going to be recorded, and I've got closed caption on as well.
All recorded. I'm definitely.
Hi, PJT. Thank you for joining us. We're gonna give another minute or so, and then we'll get started.
Okay.
Understandable.
I'm gonna have to kind of duck out at 2:30, but I'll stay on my phone. I have to go to a site.
Okay. So what I will ask people to do is mute your microphones when we get started, so that because we tend to get a lot of background noise, and then we did get a lot of questions in advance of this, so that we could put together the responses, and also to kind of coordinate, because we got them from multiple areas, and we didn't want to miss any important questions that were being asked. But if you have a question that's not on the list, if you could wait until the end, we'll do our best to get to you. If for some reason we don't get your question answered, you can send it in, and we will do our best to get it answered. Okay, does that sound reasonable to people? There's going to be
Yeah.
I'm hoping to get a lot of people to join on. It looks like we're about 61 or so. So hopefully we'll get a good response.
You're
And-
actually at 75, Randy.
Okay, well, great. That's terrific. The more the merrier. Okay. All right, I think we're going to get started. Again, I just want to thank everybody for joining us. Clearly there's a lot going on, and there's been a lot of questions and concerns about the vaccine that we're hoping to address here today. I wanted to give you kind of a little bit of a background about what's going on for some of you that may not be aware. The vaccine became available for people that are in phase 1A, which is our group, and people that are providing direct care services to individuals in our programs. We have made many efforts over the last month to secure vaccines, to identify sites where vaccines can be given, to work creatively with some of the leadership in the local hospitals and Cornerstone to try to get the vaccine supply designated for our staff. I know many of you, because I've seen the emails and questions, have tried to get online to get these vaccines, and it's been extremely difficult to secure appointments. We have been working with Nyack Hospital. We worked with Cornerstone, and we were able to get some. The problem largely is that the vaccine supply is limited. The vaccine supply is limited, and we're having difficulty continuing to secure vaccines, as for our group. So some of the efforts that have been underway, I've continued to reach out to hospital leadership, Cornerstone leadership. I've reached out to the Rockland County Department of Health, and I've been in touch with Westchester Medical Center. They are the vaccine hub for our area, to advocate for more supply. So, we have a lot of things going on here, and so we have two other issues, right? So we have the issue about supply, But then we have an issue of people not wanting to get vaccinated. And I've heard a wide variety of reasons why they don't want to. Some of it is based on, personal fear or beliefs, but some of it's based on myths and things that are just are not true. And I wanted to give people the opportunity to ask questions, to get factual information about the vaccine so that people are able to make an informed decision about getting the vaccine. We are not mandating the vaccine at Jawonio. We are not allowed to mandate the vaccine at this time. The state may at some point in the future say we have to. That is not the case now, and we are not doing that. My sole goal is to provide education to the staff, to make sure that they have all the information they need to make the decision they need to make, and to be able to work hard and get an idea of how we can continue to secure the supply. So you saw an email go out asking people that wanted to get the vaccine to send us the information of who you were, how we can contact you, and if you were willing to be on a standby list. Hospital leadership, Cornerstone leadership, the Westchester Medical Center hub know that we have a list. They know the list has been prioritized. They know that we have staff that are willing and able to be on standby to get this vaccine. So I am hopeful that we will be able to secure additional supplies of the vaccine so that we can get it to the staff that want to be vaccinated. The other thing I want to, I just want to remind people of, we have been pushing out a lot of material. We've been trying to send out, we have weekly CEO newsletters that provide you with information, about what's happening in terms of the vaccine, accessing the vaccine, information about, maintaining social distancing, personal protective equipment, because we're trying to do everything we can to keep you guys safe. I do have an ask. My ask is that you please read the information that is being sent to you. Knowledge is key. Whether you choose to follow it or get the vaccine is your choice. But we need to give you that information, and we need to know that you've received it, and that you're able to ask questions if you have any. My number is in that email, that you can contact me if you have any questions. If I don't know the answer, we will work to make sure that we get those answers to you, okay? I don't want to take up a lot more time with that. I'd like to introduce Leslie Cooper, who maybe if she could wave, you might be able to see her if you're on video. Leslie? Are you able, do you have your camera on, Leslie, and can you wave?
I have my camera on.
Okay, are you able to wave so people can
Wave.
see?
I'm waving.
Okay, good. Yeah, I see her in the back. She might be in another position there for all of you. Leslie was given a list of the questions in advance that we had. So she's going to go through some of these questions and provide answers for you all. And then I'm sorry.
That's probably me. I'm lowering my hand. Okay. Can you guys hear me?
Yes, we can hear you,
Yes.
Leslie.
Okay.
Yes, we can hear you.
Do you want me to start now, Randy?
Sorry, I'm sorry. Can you all hear me?
Yeah.
Yes.
When
Yes.
Mark, he came in to me personally and not through the group, so I just wanted to tell him to come on. Okay. All right, Leslie, do you want to get started on the questions? Thank you.
Okay, no problem. I'm going to ask people to please mute their phone or
I think
their computers.
Mostly everybody is, except for me and Randy.
Okay. I just heard some static, that's why. Okay, so I just want to start by saying that you're seeing me now a week post my second vaccine. I'm doing well. The first vaccine I was just a little bit tired and my arm hurt me. And after the second vaccine, about 24 hours later, I had the chills. I had a low-grade fever and a headache. And I took an Aleve, and I felt better within 48 hours. So I haven't grown a set of horns. My skin hasn't fallen off my body, and I don't feel as though I have a microchip in my brain. So I know that was one of the concerns. Just want to talk a little bit about the two vaccines that are out there. One is the Pfizer BioNTech, and the other one is the Moderna. The one that we're giving at Cornerstone is the Moderna. They both are made the same way. They're both genetic technologies. They do not have any virus in them. And after they're injected into the body, they don't drop off any genetic coding. All they do is when they get into the human cell is they drop off some information to allow, as we've seen pictures of the viral cell with the spike proteins. What it does is it gets into the cell and it tells the cell to grow these spike proteins so that the body's defense system can see it and say, wow, there's a foreign body in here. Let us bring up the army to combat this foreign body. And what happens is that the B cells, which are your helper cells, start forming so that if there's another invasion, it is recognized and they know that they have to grasp it and then destroy those cells. So I also wanted to say so when you have the first vaccine, you're probably, what they're saying now is you're probably between 55 to 60% covered with immunity. You have a good immune response. I guess it's like the third week. Moderna, by the time you get to the fourth week, when you're ready to have your second shot, they're thinking that you're probably almost 85% covered for the virus. Pfizer is a little bit different, but basically the same. You know, it's about 66% the first phase with the first vaccine, and then when you get the second vaccine, it brings you up to the 95%, which is what happens with Moderna. The importance of having two vaccines. The first response is going to give you those B helper cells, and if you're lucky, your body makes the T cells. The T cells are the toxic cells. They're the ones that actually destroy the virus, okay? So the B cells are helping you fight the virus, and the T cells destroy the virus. And that's what gives you the longevity in the immune response. Is that a good start, guys? Is everybody okay with that?
I have one question.
Yes.
So you said the T cells, the way you said it sounded like this is what we hope for, that the T cells would grow and they're the ones that actually destroy the virus. So what percentage, or how do we know if we actually did develop the T cells that actually protects us against the virus?
That's a very good question. We don't know because they don't recommend any antibody testing after your second dose. So what they're basically saying is that it's a whole picture. It's not that you don't also make T cells with the first dose. You do make T cells, but that second dose brings up even more of those T cells and allows it to destroy the virus when it's in your body. So that much I know.
And why do they not recommend to get the antibody test after the second dose?
They don't give an explanation. They just say that it doesn't really give us any data that's useful, because they've done extensive research on on how they've already tested it, and they know through real life testing, and that it is, when they just go by the numbers, that 95% of the people that received the actual vaccine, when exposed to the coronavirus, did not develop the virus, but 5% did. So that's how they know that it's effective. And that's how clinical trials work. They think it's a waste of resources and money. Okay. So again, we talked about, is there a difference between the Moderna and the Pfizer vaccines? Basically, no. There's very little difference between them. However, if you get Pfizer or you get Moderna for your first vaccine, you should, at this point, get the same for the second vaccine, because there's no clinical data showing that if there would be any kind of interaction or adverse effect if you took the Pfizer and then took Moderna and vice versa. So that is why they tell you stay within the vaccine family that you've taken.
Leslie, I just want to point out that, I mean, as far as I have learned from everybody that I know that have gotten it, when you get the first shot, they're already scheduling your second shot. So you should go back to whoever gave you the first shot, because they know what they did, and they give you a vaccination card. I don't know if people can see that. It's probably not that large on the screen, but they give you a vaccination card that tells you right on the card the product name and the manufacturer and the lot number, and that's what you use as proof that you have gotten the vaccine.
May I just say, as an aside, Randy, that there are places that you go that they don't give you the second, they don't give you the appointment right away. And that, I think that is, people need to be aware of that. You need to ask for it sometimes. And if you ask for it, they may say, no, just go online and, schedule your second one. It happened to somebody that I know, and they actually had their vaccine scheduled for 2 weeks after the recommended 28 days, which they're now saying is okay. You don't want to go 4 months, but if you go 2 weeks past the recommended date, they still believe that you'll get a very good immune response. There's a question.
There is a video circulating that people are getting Bell's palsy from that. Can you speak on that a little bit?
Sure. There were 4 people that during the trial they did not have the Bell's palsy. It was really in the group after they got the emergency use authorization, and they had no lingering effects, and that was their response. That was their reaction to it. It wasn't anything pre-existing that they had. It's just that was the way they responded to it. That was their side effect, so to speak, There has been nobody, when we talk about neurological side effects, There's been nobody that had the Guillain-Barré, which some people have had in the past to other vaccines. So there has not been any reported Guillain-Barré syndrome with these vaccines.
Yeah, I don't know who it is. I got it.
Any reported deaths?
Actually, there was one reported death in Orange County, I believe it was in California. And this was very, very, very recent. This was a healthcare personnel who got his second vaccine, and he developed abdominal pain and symptoms about the third day after receiving the vaccine, maybe the third or fourth day, no, the second or third day. And he then ended up passing away from multi-system organ failure. After that, the family has put out a statement which says that the gentleman was extremely pro-vaccine. He would never want people not to get the vaccine because of his situation. They are still planning themselves on getting the vaccine. They believe in it, and they haven't done an autopsy to determine what exactly happened.
I was going to ask, are they actually certain that it was the vaccination that caused the
They're not.
issues?
They're not. They're not, but because it was after the second vaccine, it was important that they report that. So,
Sad.
I know.
Leslie, maybe you could just talk a little bit to the percentage of people that actually have any type of significant reaction to the vaccine, because I think that that's probably important to people to know.
Okay, you're talking about anaphylactic reaction?
Yes.
Okay, so honestly, it's very, very low. I'm talking from my own experience. We did over 300 vaccines here, and not one person had an anaphylactic reaction. We had one person that said that their throat felt a little funny. We gave them some Benadryl, actually not even the EpiPen, and we believed it was probably more from anxiety than, and within a half hour they felt much better. That much I can tell you. You do look at, because I mean, there are so many states now that are giving out the vaccine, and the data is constantly changing. So when they talk about the anaphylactic reactions, they're not really bringing it up in terms of percentage. So, I just wanted you guys to know that also. All right. I do have an article here that pointed to 10 people that had anaphylaxis, and this is an updated report. Out of the 10 people that had the anaphylactic reaction, they had different things. One they had problems breathing. Another one, their blood pressure dropped and they became dizzy. One, they had facial swelling and nausea. So one had a diffuse rash with throats, felt like their throat was swelling. One person had wheezing, tongue swelling, and then a lot of the same things. 1, 2, 3, 4, 5, 6 out of the 10 people ended up in an inpatient, and they were all discharged home. Then there was 4 people that went to the emergency room and were discharged. So I just want to give you that is the week in the United States. That's the week of December 20.
Looks like Leslie may have gotten frozen. Can people still hear me?
Yes.
Yeah, we can
Yes.
hear you, Becky.
All right,
Yeah,
it looks like
agree.
Leslie may have froze.
Yes.
Hopefully she'll be able to get back to us. Diana, maybe you could call her on her cell and she could exit and come back in. I do want to, oh, here she is. Leslie?
My Google went out, sorry.
It's all right. I said you had frozen, so go ahead.
No, my Google totally went out and my screen went blank. Okay, you can hear me, right?
Yes, yeah,
All
we're
right,
back.
very good. Okay, so,
Leslie,
yes,
there was a message asking if you can explain what anaphylaxis means.
yes, absolutely. So anaphylaxis is an allergic reaction that causes the body to literally attack itself or become, not really attack itself, but become very inflamed. And what it does is it causes such a high allergic reaction that your tongue can swell, your throat can swell, you can get puffy, hives, and it's when the histamine in your body runs rampant. And it's another way of saying that it, like, if you eat something like peanuts or something like that, your body just starts to swell and starts to reject whatever the foreign body or what they perceive as a foreign body. It doesn't. It's momentary as long as you take what we do to treat that is we take the EpiPen. We use epinephrine, which causes it stops the histamine from well, there's the antihistamines, but it stops the attack, so to speak, and it stops the swelling. It also will increase heart rate. It will increase your blood pressure a little bit because a lot of people that have the anaphylactic allergic reaction, that type of reaction, a lot of times the blood pressure will drop. The vessels in your body kind of like relax, and it's like you're bottoming out. Is the best way to describe it, really.
Leslie, can you just talk about what you do in Cornerstone in terms of monitoring people once they've gotten the vaccine and how that's the standard for anybody that's administering this vaccine?
Of course, of course. So when you get the vaccine, so you come in and you get the vaccine, you sit for 15 minutes after the vaccine if you have no history of any allergies. So the only people that should not get this vaccine are people that have an allergic reaction to polyethylene glycol or polysorbate. Those are two additives that are, the polyethylene glycol is the additive that's in both the Pfizer and the Moderna vaccine. And the polysorbate is a cousin to the polyethylene glycol. So they're saying if you have any kind of additive in that family, if you have an allergic reaction to that, then you need to talk to an allergist or somebody to see if the risk of having the vaccine outweighs the benefits of having the vaccine. So what we do is we keep you there for 15 minutes. For the patients that I have and who have asked, like the patients from the group homes and wherever, I tell them if you have an allergic reaction to anything at all, for me, I have you sit there for 30 minutes because I want to make sure that within that first 30 minutes, you're doing okay. All right. Most of these people that I was talking about that had the anaphylactic reaction had it within 5 to 15 minutes. So it's something that happens pretty much immediately. But of course, it can happen up to 4 hours after. We don't keep you here for 4 hours, but we do give you some information on how to keep yourself safe and what to do. Most people who have anaphylaxis, who have a known anaphylaxis, they have their own EpiPen kit. So, and so because we haven't experienced, but I can tell you what we would do. If you had an allergic reaction, you had an anaphylaxis, we'd give you an EpiPen, which we have with us in our office, and I would call 911. And that's exactly what you do.
Leslie, you talked about the risks and benefits to getting the vaccine. What about the risks associated with getting COVID? Could you just talk to that for a minute?
Sure. So as we have learned, unfortunately, through personal experience in our community, having COVID, it affects people in different ways. Different people in different ways. Some people get very, very sick and need to be hospitalized, and some people just get mildly sick. However, we can't take the chance in thinking we would only be mildly sick. So the risk of dying from COVID-19, as opposed to the risk of having a complication from the vaccine, is not even within the same ballpark when you can have it safely. Now, one of the questions is, what are the long term? We don't know the long term. We're not going to know the long term. However, as it stands, what we do know is that the longer the longer the virus stays around and the longer it can replicate, the more it mutates. The more it mutates, it could either be more easily spread or it can also be more deadly. So as with anything, the risk of getting COVID versus the benefits of having the vaccine and not getting COVID is a non sequitur. You can't compare the two. It's apples and oranges in a sense. When I say to you, some people feel that herd immunity is okay. Well, herd immunity is okay for you, but it's not right for you to make that decision for somebody else. So getting this vaccine, what they're hoping, and they're not 100% sure, but what they're hoping is that it renders the viral load in your respiratory tract as of minimal risk to other people. That's why we still have to wear our masks. That's why we still have to socially distance, wash our hands, because we're not sure, but we have to do these things. What they basically said today at the briefing was, Dr. Fauci said, if the more that we allow this virus to circulate, the more mutations are going to occur. And we don't know where those mutations are going to take us. And that's not to scare anybody. This is a fact. We can see it's happening.
Leslie, you've treated people who have had COVID. What are some of the lingering effects for the people who were fortunate enough to recover from COVID?
Thank you. Well, I've treated several people that have had COVID. I can tell you the lingering effects. Fatigue is a big one, and it lasts the longest. And then there are the changes that it does to your respiratory tract, so your lungs. People that have gotten very severe COVID and even mildly severe COVID and have recovered have a long-term respiratory issue, so to speak. Some you might start needing inhalers, because what it does is it causes scar tissue to form, and it does not allow your lungs to really expand the way it did. I mean, you hear stories all the time about how people were healthy. They ran marathons, they did all of these things, and they can barely walk down the block without having to stop to take a breath. There are people that have oxygen. I know one person in particular, even now, had COVID and is currently at home on oxygen. walking around with oxygen right now. So I think that those kinds of things you have to learn almost from your colleagues or people if they're willing to talk about their stories. I think that would be a very important thing.
And have you seen COVID impacting people from a variety of age groups? Because, we have staff that are quite young and staff that are on the older side. And I think it's important that people know the impact of COVID. It doesn't necessarily discriminate.
Right. Right. No, it doesn't discriminate. Absolutely not. I mean, we're hearing that all the time. So as far as, the younger and the older, I mean, younger people can die, maybe not at the same rate, but they certainly are dying. You 30-year-olds, 40-year-olds that are passing away. I mean, I think the age range is like 45 and up. I think they said, what is it, a 96%, the people that actually passed away, 96% of them were age 45 and older. So that goes without saying, Can I just talk a little bit about the side effects of the vaccine?
Yes.
Okay, thank you. So as I had mentioned to you guys last time, I wanted to make sure that I just clarify something. So the side effects of the vaccine, there was one extra side effect that I didn't tell you about, and one of them that I know you might hear about is a topical reaction, a subcutaneous reaction on your skin. People have noticed that they get the pain in their arm, some redness. Well, as the vaccine, what I found is as the vaccine kind of dissipates into the tissue, some of it can go into the top layer of your tissue, of your skin, and it could cause itching and redness. And people have talked about having a rash too, and some firmness in the area. So what I would recommend is that you just get over-the-counter steroid cream and you put some of that on there and some, maybe a little cool compresses. That actually happened to me, so I wanted to relay that to you guys as well, because I know some of you are coming up for your second vaccines. So
there's concern about people that have gotten the first vaccine and there not being the supply for them to get their second vaccine. And I know you can't speak to this for everybody, but maybe you could talk about it from Cornerstone's perspective and what you guys have done to ensure supply.
Well, I can ensure the supply for anybody that had their vaccine here. What happened is that Laureen is our VP of nursing. She is the one that did was she got about, I guess we got dispensed like 1,000 vaccines, and we actually gave 300 of them out here in Jawonio. And so while we were dispensing our first vaccines and making appointments for your second vaccines, we got our shipment of the second vaccine. So they are securely in a very safe place right now. And so we have them for you. Then what we're hoping is in the midst of all this, another dose of first vaccines will be coming through. And I'm hoping after we do the second vaccines, we'll have another first vaccine, then second vaccine. So I'm hoping that with the federal government's involvement in doing the Defense Act, Federal Defense Act, that we will be getting more. I understand the frustration for everybody, because I am also, I have patients that in the disabled community and their families that are also looking for, that live at home, that come to some of the Jawonio Day programs and things like that, that are have been unable to get on the site to get their vaccines. And I am desperately hoping that we get another shipment in and I can get those guys in. So.
Yeah, I just so you know, Leslie, we have a list of staff that are interested in getting the vaccine and willing to be on standby for it. And I have communicated that with David and you as well, and certainly other vaccine sites in the area.
Okay.
Some of the questions that I have also seen that have come in are related to the the strain that's coming out of either the UK or South Africa, and whether or not Moderna and Pfizer are effective against those strains. So maybe you could take a minute to speak to that.
Absolutely, absolutely. Okay, so today I learned that the Moderna and Pfizer vaccines are less effective to the South Africa, and they are more. The South Africa strain is more resistant than the UK strain. That I can tell you. However, I believe it is in the 60s, over 60% effective for the South Africa strain. The Moderna is, as well as the Pfizer, right around 50, 60. Now, you and I will be like, well, that's a very small amount compared to the 95% that for the, let's say the current COVID-19. However, our flu vaccines range between 40 and 50% effective. And so what they've noted though, is that it's over 80%, over 85% effective for severe disease. So it's 60% effective, let's say, for the variant on a global scale, a general scale. However, you would most likely not get the most virulent part of the virus. Your morbidity and mortality, so your mortality, the death, would still be lower if you have these vaccines. So it has some protection for you for the new strains that are coming out. What I do want you to know is that these platforms, this is what they call these genomic vaccine platforms. These platforms are malleable, and what the U.S. has to do, and what it has been very slow in doing, is understanding the variants. So if you don't test people who are coming in sick, and you don't look and study what type of virus they have, meaning what is it, the B119 variant or the SA variant? If you don't take that serum from the patient and study it, then you don't know how many people. You don't know how the vaccine will work against that variant. So we're now up to about 5%. We're testing about 5%, 3 to 5% of people that are coming in and getting sick to see what the variants are, but it's not enough. We should be up to 10%, and that's what they do in the UK. They really are on top of trying to bring in this new information and getting ahead of the virus. So as I was saying, with the flu vaccine, we all know that we do it and some people still get the flu. However, the people that get the flu will probably not need to be hospitalized for it. Maybe won't pass it on to their grandparents or to their children or to their patients. So, they mitigate the virus. They might not cure a virus, and there's no cure right now. Does that help?
Yeah.
Okay.
You know, one of the other questions that I saw come in was about the trials that happened, and what were the demographics of those trials, and did they cover, you know, minority groups, and was there any difference on the impact of the vaccine on minority groups that you may be aware of?
So, no, the answer is no to the difference in impact on the different minority groups. I read Moderna's, and 79% were white. And then I had it all up here. And it just went down. I'm so sorry about that. And then the other 30% were Latinx and African American, Black. And then the other was Asian Pacific, Native American, things like that. So, but there was no there was no reported side effects or issue in any demographic more than another one. So, right.
Great.
I'm sorry, I have a quick question. Do you know if they tested people who had like autoimmune diseases like MS, lupus, anything like that?
So that's a good question. Yeah, they didn't have them. However, this is what we have to say about that. With autoimmune diseases, okay, you have, now what I just want to specify, these vaccines do not have any DNA in them. There's no genetic code in there. Okay, so that's number one. The mRNA is just a messenger. It's a sequence. It's a sequenced code that goes into your cell to make these spike proteins. The RNA disappears once those spike proteins are made, and they spur up the immune response. Now, what we know, people with autoimmune disease, they're on hydrochloroquine. They're on immune suppressants. So their only concern, and the only concern is that, one of the only concerns is that people that are on those medications and on chemotherapy may not get as strong a immune response as somebody that is immune competent. Okay, so that's where the rubber meets the road, is to know whether or not they are going to get such a good immune response. They're hoping that they get some immune response. I don't know what their plan is as far as testing these people, but I think that right now the emergency use authorization weighed the risk and benefits for people who are pregnant, and I'm going to go into that next, for people that have immune disorders, for people that have cancer. They took the risk and benefit profile, and the risk of getting COVID to this population is worse than the risk
Right.
of trying to spur on the immune response. Okay.
Thank you. I was going to ask about the cancer also, but you answered that. Thank you.
Okay.
Leslie, I know you
Yes.
want to get onto about pregnancy.
The pregnancy, yes.
But there is another question that I think is really important that we address, and I definitely don't want to run out of time for this one. Somebody had posed a question that they knew someone who took the vaccine, but they got COVID. Could you just talk to that a little bit so people understand how that might happen?
Yes. So as we were saying, the vaccines that are out now are 95% effective. There's going to be that 5% who get the vaccine who may still come in contact with COVID and get the disease. However, as we were saying, that hopefully it will mitigate, or it won't be as severe a disease as they would have had. Now, I would want to know the person, did they have one vaccine or did they have both vaccines? And when in the course they actually tested positive, and did they get sick? So I did see that here, that it said, I know someone who took the vaccine and still got COVID. Why? Because I know somebody that got the COVID vaccine and got COVID actually within the first 24 hours after receiving the vaccine. And they got pretty sick, but they are alive, thank God. So at that point, between getting the vaccine and already what we assume is that that person had contact with a positive COVID individual, even if they were pre-symptomatic, okay? 3 days later, they got their vaccine, but they already had the virus in their body. The vaccine started the immune response, but it's just at that point, at the very, very, very beginning. And so the virus replicated much faster than the body set up their immune response. That's what I was saying in the beginning, that our immune response to the first vaccine in 3 weeks is about 50 to 60%. Some people say at week 4, it's 85%. Okay, but if you get sick or you're exposed before you get the vaccine, then there's no way that you can have enough of an immune response to stop that virus from replicating. And that's for that.
Leslie, I mean, my understanding is there is no way that you can get COVID from the vaccine.
Oh.
That is my understanding. I just want to be clear so people understand that it's
Okay.
not because they got the vaccine, and it's possible that it was because they got the vaccine, because this is not a live virus, correct?
Not only is it not a live virus, there is no virus in it. There's no COVID virus in this. It is only mRNA sequencing, like a little ticket tape that goes into the cell. It says, okay, okay, cell, grow these little spike proteins now. And then your other body says, wait, what are those spike proteins? And then all the other cells start to flood and start to replicate, and so that they can fight that bad guy. And then they learn. They're learning how to fight. It's helping your immune system recognize an enemy and fight it. But when you are exposed beforehand, your body cannot replicate that immune response in time to stop you from getting it, because you had it before you even got the vaccine. And I have to tell you, that happens with the flu vaccine as well, because while we're talking about vaccines and the importance of vaccines, getting a flu vaccine is also very, very important. And people say they get sick from it. Most likely, you were exposed to it beforehand. You don't get it because it's inactivated. It's a dead virus. So.
I know that there's questions regarding the vaccine and pregnancy and fertility. Could you talk to that, please?
Sure, absolutely. So, now I definitely want to, address this. This was very, very important. Matter of fact, I wanted to make sure that what I did was I actually went through that with a fine-tooth comb, because I wanted to be able to let you guys know that this is how the CDC looks at whether you should be immunized when you're pregnant or not. Okay, so somebody that is pregnant right now, who works with patients, and they have high risk for getting COVID, you should be immunized. They didn't say how many weeks pregnancy you need to be or anything like that. All they said is you should be immunized discuss it with your OB first, and just make sure that that it's okay with them as well and what they recommend. However, because you get the side effect of a little bit of a fever, some people, and actually you want to get that because then you know your body's is actually meeting the need. That you take Tylenol. Very, very important for people pregnant, not pregnant. Anybody that's going for the vaccine, do not take Tylenol, Motrin, ibuprofen, or Benadryl before you get the vaccine, whether you're pregnant or you're not pregnant. That's a very, very important pearl, because once you get it, they don't know how your body will react. So after you get it, if you get a fever, you take what's safe to take in pregnancy, which is acetaminophen. And the side effects, again, go away in a short time. There's no evidence at this time that there has been a problem with somebody who was pregnant who absolutely needed the vaccine to protect themselves, their family, that there has been any issue, as opposed to getting COVID when you're pregnant. Pregnancy and COVID are very dangerous because you already have a small, your body, the pregnancy already causes your lung space to be squished, so to speak. I don't know, that's not a medical term, I'm sorry. But because you don't have as much air space because of the growing baby, the uterus, people who are pregnant tend to get a worse case, and there have been deaths in pregnant people from COVID. Okay, so again, risk benefit. There haven't been any deaths from people who have had the vaccine and COVID, but there have been deaths in people that have gotten COVID and are pregnant. So
Can
again,
you talk about the fertility, Leslie? Because I know that that's on people's minds, and it was a big question that staff brought up about that they were young, they were of childbearing years, and they were concerned about their fertility if they got this vaccine.
Okay, so what the study said was that there were people that became pregnant afterwards. They had a normal pregnancy. I know people are worried because of the word genetic. I know that, but there's no DNA in the vaccine that should hamper, interfere with the DNA of your embryo or your sperm. And that's really the bottom line. They say that, let me just go through this. No safety concerns were demonstrated in rats, that received Moderna COVID-19 vaccine prior to or during gestation in terms of female reproduction, fetal, embryonal development, or postnatal development. So that means that there was no birth defects because of it, and it doesn't render you sterile. That is, I don't know where people are hearing that, but it does not render you sterile. There's no reason why it should. It's just there to get your B cells and your T cells in fighting mode should you come across the virus.
Leslie, I think that I had recalled reading about other clinical trials and how they don't typically include people that are pregnant. Can you just talk to that?
Well, you have to understand that when people do these clinical trials, you have to ask people to be part of the trials. And that's why you see a discrepancy even in ethnicity, especially in, at-risk populations where in the past, the government and the scientific community were not respectful. And so that absolutely comes into play, and I totally get it. But in this situation, the larger population is not pregnant, you know? So what they try to do is get enough people from the general population that represents the general population before they start testing it on people that are pregnant and on children also. It's the same way. They actually did a study. I think Pfizer actually did some work between 12 and 15-year-olds, but I didn't read the details of that because I was getting ready for this one. So,
what advice do you have for somebody who may have gotten the vaccine and is still experiencing some side effects 10 days after it?
10 days?
Yes, that was in the chat.
Oh, because I have one. I have one. Oh, 1 week and 3 days after receiving the shot. I would go to their doctor.
Okay.
I mean, that's what I would do because honestly, by day 3, day 4, it usually goes away. And if it was anaphylaxis or if it was like something that was very, very serious, then it would have raised its ugly head already. And it would depend, is he getting better? Is he or she getting better? Or are they worsening? What are the symptoms? Is it diarrhea? Well, diarrhea, nausea, sometimes they are part of the side effect profile.
There was a question in the chat of what's the difference between having the antibodies if you've already had COVID versus getting the vaccine.
Okay, good. That's a great one. Thank you for doing this because then I can just keep going, right?
Sure. No problem.
I appreciate it. Okay, so people, this is the recommendations. All right, people that have had COVID most likely have a 3 to 6 month period where they have immunity. But the thing of it is we don't know the level of immunity. It depends on their body and how they responded. Maybe it depends on how sick they were and how their body responded to that illness. It depends if they had autoimmune and they didn't have much of a response. So this is what the CDC recommends. They recommend that if you just had and you were sick from COVID, you tested positive and you were sick, and you most likely built up these antibodies, there's no reason, if you'd like to put it off for 3 months, then that would be fine. But they do recommend that you get the vaccines at that time, at the 3 months, because it will only enhance and also give you more longevity in the immune response and in your coverage. So that's basically what they're saying. If you have COVID and you're due to have your first vaccine and you're sick, of course, we don't want you to do that. So you don't have the vaccine, you wait for about 3 months, you get your first, and then 3 to 4 weeks later, you're going to get your second. If you're asymptomatic and tested positive, there's no reason for you to cancel your vaccine. You can have your vaccine after your quarantine ends. So again, once your quarantine ends, after testing positive, as long as you don't have any symptoms, please come and get your vaccine. Okay?
There was another question in the vaccine about people waiting until they get the single dose vaccine that's coming out. I'm guessing maybe they're referring to Johnson & Johnson, and they're asking, is there any merit to that, to waiting so that you only have to get one vaccine?
So the Johnson & Johnson vaccine is a good vaccine. As far as it's about 85%. It's 85% effective at this time with the one. It uses a different technology. It's not the lipid nanotechnology that they're using, lipoproteins. They're using, it's a viral vector, which is what they use for the flu vaccine. So what they do is they take the inactivated or weakened virus, and they put it into an adenovirus cell. Adenovirus is what we get the common cold. And and that's what's injected into your body. It's it's all inactivated, and it's very mild. It has the same type of side effect profile like a flu vaccine, I would say. And so what happens is that once it goes into the body, it enters the cell, and then it breaks down, but it makes those spike proteins that we were talking about. It's just made in a different way. So I wanted to make sure that you knew that it's a different platform. It's made differently. Okay, so can I just say one other thing? Some viral vector vaccines, some of them duplicate. So in other words, some of them cause that virus to duplicate, and then the body responds to it. And some cause it to make the spike protein, and there's no duplication of the virus itself.
Okay. I'm going to do 2 more questions. I want to be respectful of your time, if that's okay, Leslie, because we are a couple of minutes over. What if you don't know that you have COVID and you get the vaccine? Will it still work?
So it's still going to work. Okay. I would like to know something a little bit more specific. If you get the vaccine and you have symptoms, you're probably building your own immunity at that point, especially if you're not feeling well. You don't have to get the second vaccine right away. But once you recover, they do recommend getting the second vaccine. You don't have to then start all over again. You're just going to get that second vaccine, and then that's it. Okay.
And the last question, and then we'll wrap up. Will COVID end up being similar to the flu, where each year we have to get vaccinated?
I think that right now they're so busy trying to get on top of this one, they're not 100% sure, but I think that's realistic when you think about it. It's just like in the beginning, when we were talking about masks. If you think about something logically, and that this was a novel COVID. Novel means that this was a new COVID variant. COVID itself was not new, but this variant was new. So just like flu changes and morphs, that's the same thing and we can see this happening here now. The same thing is going to happen with this. And will our bodies learn how to, once we have the antigen, once we get exposed to that virus, will our body say, oh, there's that COVID virus again, we've got to fight it. Oh, but this one has a P in it instead of an S. So let's get the P's going. I don't know how our body's really going to respond to that. But, like I said, with masks, it's just common sense. It was, people are coughing and sneezing from this virus. Why wouldn't we wear a mask?
I know that Moderna had put out about looking to create a booster shot to address some of these other strains. So it seems logical that may be something that happens in the future. I'm going to wrap up, and this has been recorded, but I do want to, I just want to talk about, just wrap up. Our main goal was to provide you with as many answers to your questions as possible. My main goal is to make sure that you are protected, that your families are protected, and that we do everything that we can on our end to secure the vaccine for the people that want it. I do strongly encourage people to get the vaccine because I do personally believe that the risk of getting the virus has far more devastating effects than the risk of getting the vaccine. That is my personal opinion. based on what I've read and what I've seen and experienced with the people who have passed from this, family, friends, colleagues. It has had a devastating effect on our country and on the world. And, you know, I would like to do everything we can to give you that information, to get you that vaccine, and to keep you safe. I will tell you that the COVID record cards, we were asked by the Office of People with Developmental Disability and the Office of Mental Health to collect people's vaccination records because we are trying to secure doses. So if we don't know if you've been vaccinated and we're only going by people that are reporting to us that they want the vaccine, the supply will be even more limited for our population and our staff. And we're trying to avoid that. I will also tell people that in terms of our residential facilities, better than 80% of our residents have been vaccinated. They're safe. We want you to be safe. So I implore you, ask your questions, talk to your own doctors, do your research, just make an informed decision. Don't go by the myths that you're seeing on the internet. Ask the relevant questions. It's a personal decision. It's not going to be yes for everybody. All I'm asking you to do is to consider the facts and make the decision that best impacts you and your family, because it's not just you you're protecting, it's whoever you go home to at night, whoever you go to visit on the weekends or in the evenings, you're protecting them too. Okay? I thank everybody for joining us. This was recorded. We will be putting out the video recording of this, and if you have additional questions, send them to Diana. We will do our best if they weren't addressed on this call to get them answered for you and get them out. And I hope everybody has a great day. Thank you for all you do for Jawonio and the people we support. I appreciate all your efforts. I know how devastating this has been for everybody, and we are doing everything we can to help you, help the people we serve, and keep you safe. If you have any ideas or suggestions, please reach out to me. You can email me. You can give me a phone call, okay? Have a great day, everybody. Be well. Thank you, Leslie. We really appreciate you joining us today and taking the time to answer all the questions.